welcome all the members of the IMA Tumkur for this CME on evidence-based nutrition by. So I request Dr. H.V. Rangaswamy sir, respected President IMA Tumkur, on the dais. I request Dr. Rajeena Shahin on the dais. And Dr. Vindhya on the dais. I request everybody to stand up for the IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Long live IMA. Thank you. I request Dr. Shruti Sharma on the dais. Our nutrition team from all India, they have come here to give a CME on the evidence-based nutrition, especially on the plant-based. And today, Dr. Rajeena Shahin is the first to give the speech on the nutrition, evidence-based nutrition. So, Dr. Rajeena Shahin, a small biodata. Dr. Rajeena Shahin is one of the thermostat champions of the transforming healthcare with therapeutic lifestyle interventions in India. She has more than 2 decades of experience in healthcare in various capacities, of which last 14 years are in nutrition and lifestyle interventions. Sought after for her perspectives and guidance in the field. In 2022, she joined as the medical director for Physician Association for the Nutrition in India, with a mission to educate and empower medical professionals about the power of evidence-based nutrition. Her major achievements and contributions: she is one of the first ones to leverage technology to revolutionize lifestyle medicine practice, and thus found Invest on Health, and her techie husband IOH is a health tech platform facilitating comprehensive therapeutic lifestyle interventions, and has transformed the lives of more than 2,500 clients of various demographics as of 2022. As a pioneer in lifestyle medicine, she has championed the cause at various forums, including Indian Society of Lifestyle Medicine and the Physicians Committee for Responsible Medicine, and also at various corporate organizations. And even at the community level, she also held the position of Director of Alliance Advocacy and Membership of Indian Society of Lifestyle Medicine from 2020 to 2022. She conducted various talks, events, outreach camps, programs and awareness programs in preventive health and lifestyle medicine. For the last 12 years, she has devoted significant energy to analyzing a large pool of nutrition data in connecting with health and diseases, and design systems, process and tools to facilitate behavioral changes. She is a medical graduate of TD Medical College, Kerala. So by this I invite Dr. Rajeena Shahin to give a talk on the evidence-based nutrition.
All of you here. Actually we were expecting a house full of doctors. Hope they will come soon. At least by 8:30, more people will be joining, right? Yeah. Yes, doesn't matter. At least, we have around 20 people here. Let's learn this effectively so that we will become the ambassadors of this mission. That's what is more important than large numbers. Okay, let's start. Basically, I've been doing this nutrition intervention for the last 15 years, so kind of know a lot about the whole field and why we are as doctors not able to leave this. So one of the things when I started nutrition intervention, my family is having a lot of doctors. When I turned into nutrition intervention, one of the things which I got from my family, especially the doctors, is why she's like wasted one seat. Okay, and it used to be criticized very badly. And at a stage where people started looking me so down, maybe 15 years ago. But now, most of these doctors, one or the other family member is a client of IOH. So that's where it took me many years to really make that impact. Like any doctor coming into the field, as doctor was saying, president was saying that India takes its own time to really adapt and make that change. But as all of you who are listening to us today, you should start the movement today itself. And with your home first, with yourself first, and then your home first, and then with your patients. So why the doctor, but medical profession always don't follow that actually. So they were saying that if the doctor does it, because of the effects of the healthcare system, people will listen. Okay, that is why the Physician Association for Nutrition in India is conducting CMEs for doctors. We need to learn about it because we haven't learned enough in our medical curriculum. Do you all believe in that? Did we learn enough nutrition in our curriculum? No. Okay, how much we learned? Exactly, that's all we learned. There is a lot more happened in nutrition over the last maybe 60, 70 years, but last 100 years, huge data, huge studies have come into the picture. You know that the last year, I was just looking at the investment has gone into nutrition. $44 billion dollars has gone into nutrition intervention studies and related research. Any one of us got any part of it? Not only from Tumkur, we have done these studies in 16 other cities, including metros with 250 doctors. None of us got it because it's going to someone else. It's not coming to us. So that means we need to really learn about it. We need to lead this. To lead this, we need to learn about it, right? So one of the things we always feel like it's confusing, unbelievably confusing. I don't understand it because one study comes, okay, it says that ghee is good for health. The next study comes that ghee is really bad for health. It is causing atherosclerosis. We are clueless what to believe in. That is because we really don't know how to look at the evidence of nutrition, right? So what is evidence-based nutrition? So as I mentioned, over the last 20 years, if you look at it, you can see that the studies happening in nutrition, in diabetes, in obesity management, it's doubling and tripling. A lot more studies, especially post-COVID era, we have lots and lots of data and studies with us. And we are not able to use the information which is available to us easily to manage our patients, even our own health, our family's health, because we are not paying enough attention to it. Any one of you here without any chronic trouble, either gastritis or any sinus infections or any NCDs or any other conditions, anybody completely healthy? I don't think so, including me. I mean, I'm much better once I started practicing these things. So that's because we are not using the potential of nutrition to optimize our health. First, we need to learn that. So evidence-based nutrition is looking at these studies and coming up with an logical conclusion what it is, right? And then practice that in our clinical practice. And when you practice in something, the patient has a completely different outlook about thing because of their cultural perspective or something else or preferences, you cannot push a patient for that. So it should be within the context of the patient preferences. Maybe that patient will take some time to adapt, but give him that time, right? So evidence-based nutrition is basically using your scientific knowledge knowledge, scientific knowledge itself is not just about one study, it's about analyzing the studies and understanding what does actually exactly science means it. And then using patient preferences and your clinical expertise to help patients, or even your families get better. Enjoy the, life to the fullest. So just like any evidence-based medicine, so evidence-based nutrition has different layers. It's a pyramid, like human studies, observational studies, intervention studies, like RCTs and all. RCTs are not something which is very frequently done in nutrition, but there are some RCTs. One of the famous RCT, I think Dr. GR's presentation I have seen, the portfolio trial. Some RCTs are there. It's majorly, now if you look at it, the top of the pyramid in nutrition studies is meta-analysis and systematic observation reviews actually, which is like large number of studies. Okay, there is some studies which is done on cholesterol or coconut thing. They put all the studies together and then they, analyze it, systematically analyze it. What is like the 360 studies it collectively talking about? Maybe some of them talking that, oh, it's not raising your cholesterol as much, but 80% of them saying that cholesterol is raised because of that. That is what a systematic analysis is all about. So when you come across any study, any patient, any of your colleagues talk about it, any particular study, you should always look for any systematic analysis, a systematic review done on it before commenting on it. That's the first thing you should do. So where are we nutrition currently? Anybody has any idea what is nutrition guideline talking about now? Any of you? What to eat? What? Okay, just a very simplified thing. What to eat in large quantity? What to minimize? Carbohydrates. Yes. This is what is happening in our fraternity. Carbohydrate is a major culprit for all diseases because insulin resistance is a major thing. That's what everybody believes in, right? Any other thing? Proteins is important, right? Yeah, this is another thing because I'm part of multiple doctors' fitness group, so I can see that. So only two things which we concerned is carbohydrate, another thing is protein. Anything else? Vitamins and minerals. So nutrition actually has gone much beyond the single nutrient focus, right? So that's what I'm coming to. First of all, it has gone beyond the calorie in, calorie out game, right? We always believe that, oh, we are eating more food, we will put on weight. It's not always the case. It's not just the calorie which matters. It's also important what kind of food you eat. What kind of food you eat has huge significance on how your body responds to it. The way we eat, if you're eating a lot of junk foods and a lot of fried items and stuff, if you're prone for a metabolic condition or an autoimmune condition, there will be a flare-up. So if you're eating much healthier food, even if you're, you have proneness for it, you may not develop it. So we call in nutrition and medicine, we call it your genes load the gun, right? The gun is the load. It's actually the genes are loaded with these things, but the trigger point is at your dinner table. The dinner. What you eat determines whether you need to have that phenotypic expression of that disease. Am I correct? Do you all believe in it? Now let's get into the details of what nutrition says currently. So calorie in and calories out is not exactly right. It is important, but what quality you eat is also very important. Second thing the nutrition world got out of, or science world got out of, is single nutrient focus. For example, it used to be because, calcium rich food, vitamin rich food, or saturated fat completely out, trans fat out. That was the thing till 80s or even till 2000. Now we are focusing on dietary patterns. Any of the dietary patterns you are aware of?
Mediterranean.
Excellent. Yes. DASH diet. Yes. Very good. So now actually over the years of research, we have got out of the individual nutrient focus where it is very similar to how we look at a drug. Single drug, which acts on it, and then we know how it is happening. But now it is dietary pattern, different dietary patterns like Mediterranean, DASH diet, MIND diet. These things are more important. How overall your diet is designed, that is more important than individual nutrients. That's how where we are right now, right? Then we are also got out of this thing of nutrient alone is not something, or the food alone is not something which is going to direct benefit. There are a lot of multi-faceted actions which is happening inside our body, which is deciding whether you need to have optimum health or you need to get, you will get diseases. So it's not just restricted to, it's not a one-on-one relationship. It's much complex than that, right? But we are actually, all of you guys have done medicine, and such a, it is supposed to be considered as one of the toughest course in the world. We all came out of it. We do have the complexity of our brain. Our brain has the capacity to really analyze, understand, and practice this. So let's not think that it's not something which is confusing, which I will not understand. You all will understand. Need to put little effort. So some of these areas are emerging, which we don't have clear-cut idea, like bioactives, like polyphenols and flavonoids, which is supposed to be very good for health, and some of the intermittent fasting related things, personalized nutrition, food allergies, food and cancer, all these things we still don't have clear-cut clarity. But 70% of the things we do have clarity. That's the thing we need to be focusing on. And currently, one of the things which I want to bring to your discussion is actually, this study is very important because it was done in 204 countries with lakhs of people. They've analyzed their dietary pattern. I think around 15 dietary factors were analyzed, and they found that these are the reasons why people are getting sick, right? Mortality and morbidity, the reasons are this. It says that food which is high in sodium, red meat, and also look at, always Dr. Rajendiran says, look at the things which they are not consuming enough. What are the ones? Nuts, seeds, vegetables, fruits, whole grains, legumes. They are not consuming enough. How many of you takes 450 or 500 grams of vegetables a day? No? Nobody. Yes. That's what actually. So we are not taking enough vegetables. What are we consuming large quantity then? Yeah, grains. Grains is something which we consume in large quantity. But this is predominantly done in a Western context. So they're saying that not under consumption of grains also is a reason for mortality and morbidity. In the Indian context, it may not be applicable because we consume 70 to 80% of our calories from grains. That too, grains is healthy, but in moderate quantity, but we are eating whole refined grains, white grains. That is something we need to change. How many of you have shifted to whole grains like millets or brown rice? Wow. Yeah. Oh, there is a reason, right? Yeah. So there is a health challenge, or before that itself you've changed, shifted. So is there any? Yes, challenge only. Great, actually, but that's great. So you are on millets. Okay, great, wonderful. So this is actually taken from one of the slides from Dr. Mazzafarin. He is a Tufts University cardiologist, which is driving the US nutrition world actually. Stanford, Harvard, TN Stan, and the Tufts is majorly doing all research in the field. So this is what he's saying. So eat more of the one on top. They are, and in our words, in the medical fraternity's word, they are carb rich, but they are complex carb rich. They are fiber rich, they are polyphenol rich, they are phytonutrient rich, flavonoid rich, many other nutrient benefits are there. Vegetables, fruits, whole grains, legumes, nuts and seeds, that's what we need to eat, right? Larger quantity, and definitely look at some of the other ones. Fish and yogurt, some part is okay, what Mediterranean studies and other stuff says, but like the way it is currently going, it is definitely affecting our ecosystem. It is actually stuffed with a lot of lead and other things, so think about it before you eat that. And the one on the red side, please do not consume, because you're consuming that because it's easily available. Once you start consuming, your taste buds get used to that high fat, high sugar, high salt stuff, and you will get addicted to it. Once you get addicted to it, you cannot really like the taste of vegetables or fruits, and you are actually all the time under the slavery. Actually, you are becoming addicted to it, and that addictive behavior is one of the reasons why we are all getting sick. And medical fraternity, I was looking at Summa, just one random survey I've done with a medical group. I think it was, yeah, it was a Kerala based one, okay? Because I'm from Kerala, because I have access to them. 35%, the people who attended, out of that 35% of the doctors having metabolic diseases. You know why? Then we were having a discussion. Look at the kind of, a surgeon comes out of the surgical ward and he's going to the canteen. What is he eating? What is he eating? Oh, he's so tired. And high sugar-based tea or coffee, right? That's what he's eating. So we need to change the system. And how do we change the system? Becoming aware, having constant dialogues about it, and then influencing the policymakers, authorities, hospital authorities to change it, so that you are not the victim of that system which they developed, right? And nutrition intervention, with this context, you understood the ones on the top are the healthiest. The ones on the top are healthiest because they are rich in fiber, they are rich in complex carbohydrates, they have proteins, especially legumes, nuts and seeds are proteins. These things also have a lot of polyphenols. I told you, bioactives, a lot of research is going on in the field, which is helpful. It just helpful for us to reverse conditions. It has a lot of antioxidants. It scavenges the free radicals. Many benefits are there actually. So that is something which you need to consume in larger quantity. But I do agree that the whole grain part, a large part of it, I agree, we overconsume them. It has to be moderated. It should be only 1/4 of the plate, right? Vegetables and fruits should be half of the plate. So then with this context, we will see what is happening with obesity. Obesity, I don't want to discuss a lot about it. All medical doctors know that it is a complex multifactorial disease. It is chronic inflammatory condition. When you have excess fat, there is definitely inflammation happening in our body. And what is a cutoff point in the Asian context? Obesity. This I have taken the global cutoff. It is 25.
22.9.
Excellent. Very good actually. This crowd is very, very interactive and very nice. So 22.9. So when 22.9, I don't think even I come under the category. I'm already 23. Sorry, but I'm 23. Yes. So that means actually, so in nurses study, I'm also very interested in the anti-aging part of it and disease reversals and all. So I was looking at one of the sub-study which says that people who have the BMI 22 and below have a much lesser risk of chronic disease. I think 80% lesser risk of diseases than people who are over 27 and above. Anybody who is in the obese category actually will need to start some kind of a lifestyle adaptation to bring it down to around 22.9. That is something which, another message I want all of you to take it home. Obesity pathology, this is something which we all know. Energy intake and energy output, calorie thing which we all know, that energy intake very high because it is very high because not just because we are all eating very consciously this in the system. Today also we wanted to entertain you and make you happy. We have some fried items, which is again calorie rich, right? So the system, the food, the environment itself is so bad, so that it already is obesogenic. And energy expenditure, because how many of you walk or do any exercise? Wow, very good. How long you walk back?
1 hour and 20 minutes yoga.
Oh, beautiful actually. So your blood sugar, everything is normal?
Yeah, fine.
Excellent, very good.
5.8.
I think we should encourage that.
Yes.
Thank you.
1 hour yoga and 20 minutes.
20 minutes yoga, 1 hour.
1 hour, excellent. Ma'am?
1 hour walking,
Excellent.
then 1 hour meditation,
Oh, wonderful.
and about 20 minutes of yoga.
Excellent. Anybody else, sir?
1 hour. 45 minutes walk, 30 minutes yoga.
Excellent, excellent. Actually, that's why not many obese and people here in the group. Very good, actually. Even Jaipur, I felt so. It was very similar. Maybe the smaller towns works better. than the cities because so much of unwanted stuff there. So that calorie intake, calorie output, your calorie intake, I told, the food system is really bad. Just now we experienced it. Shruti should be blamed for it. So normally we give healthier food, but the options here are much lesser, so we didn't have any option. Energy expenditure, we are all doing it actually. The rest of the people who have not started, start with exercise. Dr. GR is long distance runner. He runs long distance. I keep seeing when Vindhya most of the days walking in the morning, even I'm going the car. For my exercise, I'm very often, I'm very good with eating habits. My exercise is limited to actually 30 minutes structured walk, and then I take a conscious effort and get up from my seat every 1 to 2 hours, and then do a 5 minutes walk or jump, and then do squats. Actually, I keep doing that. That makes me, keep in shape. Otherwise, I'm very bad with long hours of exercise actually. So, but whatever works for you. But it's important to include like 60 to 90 minutes of some movement in your life. And then gut microbiota. How many of you heard about gut microbiota? Can you tell me what you understood that? Whatever it is. Yes, ma'am. Patsy. Hello. What's your name, ma'am?
I'm Dr. Nalini.
Okay.
So, gut microbe is something about, to have healthy digestion, which many people ignore. You should have a good amount of gut bacteria. Good gut flora is very important. So what happens is, and that depends on what we eat. The diet matters a lot. So whenever we eat this highly processed foods, they tend to destroy all the bad bacteria, and the good microbial flora decreases. So that is why the focus now is shifted on eating fermented foods, probiotics, which are going to increase your good flora in your gut, which in turn leads to good gut immunity, which in turn leads to managing a whole lot of things in your system.
Very good, very good. So basically, yeah, one of the things which I want to add, that microbiota is very important. It is like one focus of nutrition discussions everywhere right now. Because there are a lot of studies which is saying that the colonic bacteria, which is inhabiting in a colon, is actually responsible not only for your bowel movements and other related stuff or things. It is also actually important in managing our energy intake expenditure thing, what you call that feeding habits. It also is important in metabolic diseases, cancer prevention, multiple of those things. And as ma'am said, probiotic food is important. Prebiotic food is also important. Where is the prebiotic coming from? Prebiotic is the one which the gut bacteria feeds on to have those activities. Where is the prebiotic coming from? Which food?
Fermented food, like
that is probiotic, right?
yeast, fiber,
Perfect. So fiber is the prebiotic for the probiotic bacteria. When you're eating high fiber rich food, you are actually indirectly feeding your probiotics, which is there in the gut, microbiota, right? So how many of you ever checked your fiber intake in a day? That is something we call it. Actually, like there are like a lot of research saying that before even we say the risk factors of diseases, behavioral risk factors is very. Okay. Do any of you know that which food has highest fiber? Raw vegetables and fruits.
banana,
Green vegetables. Sweet potato, very good, okay. Cabbage. So, one of the highest fiber containing food, when it looks at the calorie or even the portion, is legume. Dal. 1 cup dal. How many grams of fiber? 14 to 16 grams of fiber. How much? What is our fiber intake? What should be our fiber intake in a day?
15 to 30%.
Okay, very good. 30 to 40 grams. So, like more than 2/3 of the fiber intake is met if you're taking 1 cup dal, right? And definitely 1 cup salad, 4 to 5 grams. Banana, 3 grams. So it is something which is more in plant-based food, plants. Okay. So that is gut microbiota. Gut microbiota is not just about your some bacteria staying there. It also has significant action when it comes to your metabolic health, your energy intake balance and stuff. And definitely then genetic factors, epigenetics is very important. Yeah. So this actually we have already mentioned obesogenic. We have an obesogenic environment. I'm sorry that we ourselves have given an obesogenic food in the evening to make you feel better. You know, some of these fried items gives us a immediate dopamine surge. That's what's given, but it just comes down immediately. You can see that after you feel tired and sleepy. Okay, so that is something which is happening. And energy expenditure, as I mentioned, one energy expenditure we talk about is only about the kind of exercises we do, the physical structured exercises we do. But there are so many other things. A large part of your energy expenditure. How many of you use the watch, Apple Watch, or any of the devices? You are using it. So you know the total energy expenditure. How much is it showing in a day? 2000, 2200 range? Yes. So do you know that 80% of it is BMR, your basal metabolic rate, which is your internal organ functions? Yes. So the only a small part of it is actually exercise related thing, right? So when you are walking, maybe 1 hour, okay, regular brisk walk, you are only expending around 300 calories a day. So that means for somebody to lose weight, more than the walk, you need to work on your intake, food intake. Then thermic effect of food, you know that actually these are not largely significant, but it is still significant. When protein to digest or getting absorbed, it takes 20 to 30% of the energy which is coming from food. That is why most of the cases protein-rich food works better in weight loss. Okay, that is why most of the protein-rich food works better because it's already providing some kind of a energy deficit. Then carbohydrate is 6 to 8%, high fat food 3 to 5% only. When you're eating higher food, it's not taking any time to use it for the work, any energy to use it for the work. Then non-exercise thermogenesis, this is very simple, funny example I give you. Two sisters were there, their husbands were there with us for weight loss. Okay. So what happened is actually one couple, the lady is a little fidgety all the time moving around and keep doing something, but she's not into highly structured activity. The other couple always does the 1 hour intense physical activity, but who are losing more weight was the people, the fidgety couple. They are into something, they go for outdoor thing, they walk with the dog. There are a lot of non-exercise thermogenic activity was going on. And finally, this couple started fighting with us. My sister is losing more weight than myself. Why is it not happening? So then we told, and then we had a meeting with them. This is the reason. They have a lot of activity which is happening other than the one structured exercise, which they are doing much lesser than that. So this is also important. Incorporate activities into your day unconsciously or consciously. That become an unconscious activity. So understood all this slide well? Okay. And micro environment which we already mentioned. So what, just a little more explanation. When you are eating a fiber-rich food, even your gut microbiota is not variant. It's not having different type of bacteria to give you that optimum health. Your gut microbiota, the existing gut microbiota feeds on the fiber and it mutates and forms variety of microbiota. Because of the variety of microbiota, the effect will be higher. And there are studies which says that there are two types of bacteria were studied in detail: bacteroidetes, and fusobacteria. Yeah, firmicutes actually. Firmicutes actually is a kind of bacteria which, when this large numbers, actually animal models, high fat favored firmicutes. That means you are eating animal food or oil-rich food. It was enhancing the growth of firmicutes, which was reason for obesity. The people who were having obesity, they were analyzed the fecal flora. They understood that people who are obese were having high firmicutes. and people who are thin and healthier were having more bacteroides. Did you understand? So that means when you're eating your high fat, animal rich food, you're not just giving fat for the body to really accumulate or excess calories, you're also feeding a bacteria which also will indirectly lead to obesity. Okay. So eat more plants and fiber rich food. So that is one thing, and there are a lot of other things which plays a role in gut microbiota, as I mentioned. So there is something called the short chain fatty acid, which is again extensively studied over the last 10-15 years. Anybody, ma'am should know. Yes, please. Short chain fatty acid. Any of the short chain fatty acid you are aware of?
Yeah. We have UFAS, UFAS. So these are the short chain fatty acids.
Yes.
But, can you just highlight and how exactly this short chain fatty acids play a role in this microbiota?
Yes. So short chain fatty acid actually, so what I mentioned is actually there is microbiota in the colon, okay, which has different variety of microbiota, okay. There are formicutes, bacteroidetes, lactobacillus, bifido, different type of things are there. So only one thing which is currently studied is formicutes and bacteroidetes. So the ones people with obesity, once they analyzed, they understood that the formicutes are high, bacteroidetes are low. So then they understood that people who are high on high fat animal products were having high formicutes high. That means if this high fat animal consumption is directly related to high formicutes in the colon, which is indirectly leading to obesity. So that is actually the thing which is saying that. So the short chain fatty acids. So the short chain fatty acids, yes.
No, this is quite contradictory to the fact that protein-rich diet will which will aid in weight loss. That is the common thing, right? So when you say protein-rich food, which obviously means that a lot of people opt for non-vegetarian food, invariably there is fat associated with non-vegetarian food. So you mean to say it's quite contradictory to the fact that
exactly. I'm explaining to that actually. Yeah, please. Yeah.
So how does it work?
Okay. So what happens is actually the low carbohydrate diet, which can be either fat rich or protein rich. So when they were giving low carbohydrate diet, the thing is actually the Indian context, if you take the larger portion of our food, which is coming from carbohydrate, grain rich food, right? Once it comes down, the overall calorie itself comes down, and the small portion of, or a good portion, maybe 100 grams of animal protein is added. Animal protein, as in the previous slide I've already told you, it takes 20 to 30% of the energy, 20% at least energy to even metabolize itself. So what we need to understand is, so that is there is no denial of that fact. But at the same time, if you are eating a high fiber, complex carbohydrate rich food in the right way, you are already giving a calorie restriction. I'm coming to that in the next slide, how it happens. Giving some examples, 1 cup of cooked mutton can be around 300 plus calories. 1 cup of cooked legumes can be around 180, 190 calories. So there itself there is a calorie restriction, right? And at the same time, it is also acting on your colonic bacteria. You are very clear that colonic bacteria is fed by the prebiotic which is coming with fiber. So that's very important. The second one, what I want to tell you is actually that next slide is talking about it. That protein, when you're thinking about protein, should I go to that slide or?
Yes, please.
Yeah, I'll go to that slide. Yes. Okay, so pathogenesis, microenvironment and gut microbiota is very important. As I mentioned, high fiber rich food, it also enhances your gut microbiota. See, we are all actually, I'm on a very high carbohydrate diet, if you ask me, because one of the things why the medical fraternity is stuck with the carbohydrate is because we focused a lot on insulin resistance over the last 20 years. But if you look 30 years back, like in 1980s to 80s to 2000, it was like lipidogenesis, lipid thing. We focused a lot on lipids. High fat diet is bad, that has caused the problem, then taking out all the fat. Then actually what happens in America when they took out the fat, they replaced it with the carbohydrate. the carbohydrate, the refined white, the sugar, which was actually filling all the cereal boxes. That people started consuming larger quantity, they started getting sick because of diabetes and obesity. Okay, so fat is back, carbohydrate is back. What is the best nutrient left with now? Protein. So that the next 20 years, now we are focusing on protein because we feel that that is a nutrient which is much harmless. But there are a lot of studies over the years coming up now. It is even causing kidney damage. Yes, proteinuria. And Dr. GR will have a session about aging and proteins. mTOR activation, higher protein diet will lead to mTOR activation, which is one of the gene which is highly studied in aging in rats. Actually, you can look at Dr. David Sinclair's videos. Actually, or his studies. Actually, it is very well explained. Actually, so protein is important. Nobody is saying protein is not important. People who are taking animal proteins, moderate it. Try and go off at least few times a week. Protein package matters. All the animal proteins without any thing, it also comes with the saturated fat and also sometimes dietary cholesterol. So dietary cholesterol, like we know that dietary cholesterol restriction is taken out from most of the guidelines, but it is still saying that 20% of the population is hyperresponders. We don't know we are hyperresponders. Saturated fat is really bad. Look at animal proteins. Lamb, how many grams of saturated fat is there in lamb? 8 grams, right? 100. So how many grams of saturated fat is there in ghee? 8 grams. Another one, even plant-based one, coconut oil. How much is there? 11 grams out of 13 grams. So these are all saturated fat rich food. What does American Heart Association saying? How much percentage of our diet can be saturated fat? 5 to 6% of the total calorie. That means an average person, you should not exceed more than 10, 12 or 13 grams of saturated fat. When you are eating 100 grams of mutton, you are already giving 8. 1 tablespoon ghee added, another 8. 16 grams, you are already above that. Then you are actually complaining that, okay, my system around thing is wrong, I'm getting atherosclerosis. That's, or Indian genes are prone for it. It's not. Your dining, your dinner table is the reason. Start changing that, right? Am I correct? Do you all believe in? Yeah. So, neurobiological thing, mechanism, again, a newer one. It's like more and more things we are understanding about it. There are many things which is playing a role. Great. Leptin, anybody heard about? The adipocytes produce leptin, which gives us the feeling of satiety. Yes. Ghrelin, which is produced in our stomach, which is feeling of feeding. I'm hungry. So these hormones are also playing a role, and also that neurotransmitters like dopamine, serotonin. When they are higher, you feel lesser hunger, or you will not get put on weight. When it is lesser, you will start putting on weight. So these are all actually newer field, but it is establishing quite fast now. Genetics and epigenetics. You may be, as I mentioned, you may be prone for diabetes. You may be prone for obesogenic type 2 diabetes. You may be prone for obesity, but it is your eating pattern which determines that's a trigger point whether you need to express. Phenotypic expression is done by that. So then this I don't need to explain. Obesity is a chronic inflammatory disease. It affects all our organs. All our organs, it doesn't deprive any. It doesn't spare any organ. So what we need is, there are risk factors which is multifactorial. There are diseases which is affecting multiple systems. So when you are working out obesity, work out evaluation for obesity for any patient, you need to incorporate these things. See, most of the things, maybe in our case, most of the people are coming from little well-to-do families and all, they are ready for a complete evaluation. We do the complete evaluation, which is the metabolic parameters completely checked, medical history is checked, lab test includes cholesterol, diabetic profile, LFT, RFT. LFT, why? Why obesity and LFT? Excellent. Yeah. Very good. And then hypothyroidism, because one of the common association which is seen in that actually. So it is not something, obesity, oh, this person is coming with obesity, let me send that person to nutrition. That doesn't work, because you are doing actually, you are actually taking a privilege out of the patient if you are not treating the patient with obesity. You need to have the understanding that multifactorial, it is giving diseases of multiple organs. So if you are the right person to treat obesity, don't think that obesity can be treated by a diabetologist. He will be able to give, or she will be able to give a dietary pattern for 1 month, 2 months. They will lose 3-4 kgs, but go back, gain it back again. That's not the way to treat obesity, because it's the root cause for many illnesses. So this, we all know that actually. So I don't want to discuss the top pyramid. You know that there is drugs. Anybody knows about the, yeah, everybody knows about the current trend. What is the name of the drug? Which is the one? Orlistat, yes. Yes, everybody knows about it. And there are, we still don't have enough data about it. I do have experiences with few clients. Those few clients aren't supposed to be doctors. Okay, they've used it. One of the doctor from Middle East, he was with me his family was with us for at least 1 year. They've lost weight, and he was a little diabetic, and he was already having metabolic syndrome. He lost around 25 kgs, his son lost around 15 kgs, but he got into a obsession with fitness and stuff. He went ahead with this. He has lost another 15 kgs, looking smart, but he looking much older than the way he is. His wife, again, she's an ENT, she keeps complaining, Dr. Rajeena, please speak to him, he looks like my father. Sorry to say that, but this is what is happening. So we need to have our right methodology to kind of address these scenarios. So the best method is what? To manage obesity. Lifestyle intervention. Am I correct? Or behavioral adaptation. Then why is it not working most of the time? You're lazy. The environment itself is bad. We also not patient enough. We are not patient enough with our patience is lost. So when you are managing obesity, as I mentioned, behavioral intervention is the only way. And drugs may work better. Even a prescriptive nutrition dietary pattern will work for shorter. But the best way to manage obesity is a behavioral intervention. You start changing the dietary pattern of the person, not just following a dietary prescription to the patient for short term. It has to be a habit which should form. Normally it takes, like science says, that when a client comes, we say that it takes 66 to 256 days to form habits. Give that time. Be patient with your patient. Be patient with your family, your own self. So it takes time. It is frustrating. It is really, sometimes it is like you feel like it doesn't work, but it works wonders. It's not just the weight loss of taking you out of a chronic condition. It is actually making you to live life the fullest. I say that patient helping people to thrive with life, not just surviving with some medications and stuff. Right? That is what we want with our patients. At least that's what we want for us and our families. Am I correct? Yeah? So management, again, it's not just a dietary adaptation, it's the lifestyle intervention, which has a component: nutrition, dietary pattern, sleep, yeah. Why sleep is important? Melatonin, serotonin, all these NTs and other hormones work.
Stress.
Yes, cortisol.
Cortisol comes down.
So when there is not enough sleep, the cortisol goes up. Cortisol is a hormone which is going up when you are waking up, because that's the one which is giving you that energy and vibrancy to do things. But that also has to be balanced, right? It goes high and you get into a phase where you start eating the wrong food. You're stressed because you didn't get enough sleep. You may not know your body is under stress, and you start going for the high fat food, high salt food, high sugar food. That's what the science says. So it's very important to get adequate sleep. So sleep is an integral part. Alcohol. How much calorie 1 gram of alcohol provides?
7. Incoming voice call from
Who's that? 7? Ma'am, you are very well knowledgeable. Huh? Very good. Excellent. So dietary adaptation, when it comes to, this is the simple things you need to understand. So the high calorie, nutrient poor food. We need to take out that high calorie, nutrient poor food from our diet. As ma'am said, the ultra processed food, high sugar food, refined carbohydrate, all these things needs to be taken from our diet. Fill it with lower calorie, highly nutritious food like vegetables and fruits. And then when it comes to some of the nutrient rich food like proteins, as ma'am says, proteins predominantly, the idea is like it comes from animal product. It's not. So as I mentioned, 1 cup of dal is around 200 calories. It provides 16 grams of proteins. 100 grams of chicken is around 200 calories, 165 to 200 calories or 235 calories. It provides 25 grams of protein. But both are proteins. What is the difference? Protein package matters. The protein which is coming from plants, it also comes with the fiber, polyphenols, flavonoids, many other nutrients. This has protein, definitely if your intention is to build muscles, it will work. I think I'm taking a too long time. I'll just finish it off. Protein, as I mentioned, package matters. It's very important to reduce the proteins, which is high in saturated fat and other bad stuff. So I will be talking about DMA or advanced glycosylation products. All these things are also coming from animal-based proteins. Yeah, look at the things. You were talking, most of the things people in our fraternity, they always think animals, proteins are the proteins. Proteins comes from all these things. I eat at least 1 to 2 servings of legumes a day because I don't eat much grains. I reduce the grains to 1 serving. I eat 1 to 1.5 servings of legumes a day. All the blues. How many of you watched Bluesonian documentary? Blueson documentary? Yeah, that is yes, doctor. So yeah, very good. Thank you. What's your name, doc?
Atish.
So that's a documentary which is talking about the food habits. One of the commonest habit which is like constant across blue zones is they eat large quantities of legumes. Legumes is, what are legumes? Anything pods of leguminous plants, which is dal or lentils, beans like kidney bean and cowpea and stuff, and then we have the peas. These are called legumes actually. So legumes, in an average, a cup of a cooked legume will have 14 to 18 grams of proteins. So don't think that only animals give proteins. Yeah, this animal products, it's all actually very interesting when you think about muscles and stuff, but it is also giving saturated fat. It also is a reason for trimethylamine, this thing, advanced glycosylation end products. When advanced glycosylation end products accumulates in our body in large quantity, what will happen? We again tend to develop all these diseases, including cancer, right? So it's important, select your food wisely. I'm not saying currently completely go off animal products, but start predominantly going for plant-based ones, right? Ghee, this is something, whole food. When you're talking about fat, go for the whole food sources of fat. Whole food sources of fat are nuts, seeds, and avocado. How many of you eat nuts and seeds every day? Excellent. Which all nuts you are eating?
All nuts.
Excellent. Seeds, anybody seeds? Edible seeds? Which one?
Pumpkin seeds, sunflower seeds, chia
Excellent.
seeds.
What made you to start that habit?
Good. Wholesome.
Good fats.
Good fat, magnesium.
Omega-3.
Omega-3. Excellent. Very good. Very good. Actually, I'm so surprised that. Yeah, excellent. So that's very important. 1 ounce of nuts. 1 ounce of nuts or seeds a day is something which is to be incorporated into your diet. If you are not having much carbohydrate, you can give room for even 1.5 or 2 ounces. A lot of anti-aging diets is basically based on nuts and seeds because of omega-3, because of other polyphenols. Seeds, chia seed and all have a lot of flavonoids and polyphenols which will help us prevent our diseases. Yeah, I don't want to go a lot into these things. I think this one is Vindhya's presentation already has the meal plating, right? There. So then I don't want to get into the thing. So this is something which I suggest. So don't do it every day right now. Just one day when you're comfortable at home, start creating a plate like this. Half of the plate filled with vegetables. Today we have a plant-based meal. Keep filling your plate with the salads in the first place. Okay, half of the plate with salads. Then 1/4 of your plate with a little protein product like the dal and stuff. Okay, then we have tofu here, which is soya product, minimally processed soya product. And the other half, other 1/4 with a little grain portion like millet or brown rice or anything which is smaller quantity. Start eating like this once a week, then make it twice a week. You will start changing. You will start seeing the difference. Your skin will start anti-aging. Your energy level goes high. You feel much more connected with the world. A lot of benefits actually. In our book it says that people who are following whole food plant-based diet, this kind of a dietary pattern, okay, with lots of vegetables, fruits, legumes and this, have something called eudaimonia. You feel happy because you're doing something great, not because somebody else told you, right? Oh, you're looking nice or you are doing great. You're feeling happy because what you're doing makes you feel happy. Right? That is eudaimonia. Then hedonia is like, oh, Dr. Rajendiran told me that you're doing a nice percentage, I feel happy. It's not that actually. So that is something which is very important for us to feel happy and healthy. As the Bluesonians say, they have a purpose in life. That makes us really happy. So with this I'll stop. I think Dr. Gia will take up. Hope you enjoyed.
All these brought by the ICMA 2020 guidelines.
Similar guidelines, yes. ICMA plate is also there, I think.
Now in the pyramid basis with
Yeah, ICMA pyramid, the latest one of 24, if you see half of the plate is filled with vegetables and fruits. The 24 one, actually I think I'll have it. Yeah, you have it. Yes.
Ma'am, one more thing. Can you please explain about gluten-free diet, which has been much talked about nowadays?
Anybody can cover this one? Gluten-free?
Much talked about.
Gluten-free. Gluten-free. Okay. If you're not covered, I will just. So gluten, actually, these are, as again I'm saying, actually, a lot of these things are fads actually. So overall dietary pattern is important. In that, you need to have a grain portion. Grain mostly comes from any of the things in the Indian context, which is coming from gluten-rich wheat. But over the years, actually, a lot of research have gone into gluten, especially in autoimmune conditions. So in autoimmune conditions, we also ask people to avoid all the proteins like gluten, which is allergenic and produces these kind of reactions in our body. But a common man, normal man, who doesn't have any gluten allergy or celiac disease, why do we ask people to avoid gluten? Wheat has 14 to 15% of its energy coming from protein, whereas rice has only 6 to 7%. Even millet has only 7.6%. So it's a high protein thing. So I think based on the condition, the patient is having an autoimmune thyroiditis or autoimmune related diabetic thing or any other autoimmune conditions, it definitely is something which we can ask them to reduce. Or any other underlying conditions, celiac disease, gluten allergy. But otherwise, there is no need to reduce it. But again, understand that pattern is important. If somebody is eating large quantities of wheat and ghee, it's not something helping him. Keep only 1/4 of your plate wheat. Rest fill it with vegetables, some proteins, and then wheat. That's the way.
Anything about resistant starch and weight loss?
Yeah. Yes. Okay. Can I come back because we'll finish it off? Otherwise, I'll talk. Anybody else? Any other questions?
I have a question regarding BMR. Is there any way or possible ways to increase the BMR?
Yeah, there are ways actually, but yeah. So basically, one of the resistant starch also I will talk about it. So yeah, weight loss. It's a BMR. Okay, basal metabolic rate. So basal metabolic rate actually there are few things which science right now says we can increase it. One is actually a high nut-based diet actually, which increases physical activity. Any physical activity will improve your BMR actually. These are the two things which is solid, and there are multiple things which says that Garcinia Cambogia increases your BMR and all, but it is not an established thing. But physical activity, if you do, naturally your BMR goes high. If you start strength training, your BMR goes high because the muscle contraction itself on its own will require energy. So naturally the BMR goes high. So strength training is something we should do at times. Anything, one more person I said.
No, it's actually very similar to what BMR. What I have seen is especially women around the postmenopausal age, we see that the BMR comes down. So how, in spite of following good fat diets and doing good amount of moderate exercise, if their BMR is falling down, it doesn't seem to be giving much results.
I totally agree.
So
I totally agree. So one of the two things we do here, especially people in the menopausal thing, the resistance starts. I was not able to this thing. It was like I was trying to connect actually. I will talk about it. So yeah, BMR and women. So women, definitely there is that 40 something, very menopausal age group, there is a reduction. So one of the things we do is you need better calorie restriction. There is no way out. So one of the better ways of calorie restriction is increasing your vegetable fruit intake, reducing the grain portion, oil cut down or reduce the oil. So naturally a plate may look similar like another person, but the oil consumption comes down and the grain consumption comes down. Naturally the overall calorie goes down. So that is one thing which helps them. Ask them to do weight training, strength training. Strength training definitely helps overall. Sometimes it may not be apparent in the scale, but overall your body fat percentage comes down. The lean body mass goes fine. So that is something which you should suggest. And increasing your fruit intake is something which works wonders with us because it actually, one simple thing is 1 cup of mixed vegetable is only 40 calories, whereas 1 cup of rice is around 200 calories. So that variation it comes at. I'll talk about resistant starch. I'll just recollect that a little more in mind.
Thank you very much for your beautiful presentation regarding diet, nutrition, NCD, everything you covered, madam. Thank you very much. Now I request Dr. G. Rajendiran, MD DM Cardiology, Head of the Department of Preventive Cardiology. He will address himself and he gives his biodata by himself only.
Always think of interventions. That is precisely what I was doing possibly a decade ago. And then I switched over to preventive cardiology. They say just switch off your mobile. Okay. But here is something slightly different. I would like you people to switch on the mobile and keep the internet also on. So this is the whole food plant-based diet that I feel is the future of the CBD. I'll just try to justify this in the talk. Just does it take you to, okay, fine. If you want to write your name, it's fine. Otherwise, that's also. If you don't want to identify yourself, that's okay. If everybody has done, I'll go on to the next slide. It's not working? Quite a few people have got. Okay, I'll start off with a question first. Something which might look unrelated to the topic. Can you see a stain? Can you see a stain over here? Is it possible to see?
Yes.
Okay, maybe for a second, can you switch off the lights for a second? So what is the likely cause for this stain? Any guesses? You can just type on the screen. Is that there is a place for typing? Okay. but I'm not seeing any response over here. Has anybody typed and submitted? You're not able to type? The question is shown in your screen or what? It's shown in the screen. There is a place for you to type. Yeah, please. Okay, I will not wait for the response because the answer will be given at the end of the session, and I will give an introduction about myself. So I got into nature, and these are some of the pictures. I'm not a photographer, I love nature, and possibly that's the reason why it comes good on the screen. So these are some of the pictures we took up in the last few decades, and some pictures from my terrace garden which I maintain. It's around 400 to 500 plants, and some beautiful pets. And Dr. Rajeena was stressing on the diet. See how much I eat. I don't look like that, but this is my lunch plate and breakfast. And yeah, I started running a few years ago because of motivation by my team. And this is what I was doing a few decades ago. I'm sure you can identify this. Carotid artery stenosis has dented this. And a carotid body tumor, people used to call me from surgery. So I started embolizing these things. These are all in 2000s. And this is an iliac artery bifurcation stenting. Well, I was also associated with logicians. This is a postpartum bleed. A pseudoaneurysm which was called by pulmonologists to coil the bronchial arteries. This is a pseudoaneurysm bronchial artery. And of course I was involved with hepatologists also. This is a Budd-Chiari syndrome where it could open the hepatic vein. So this is precisely what an interventional cardiologist or a radiologist does. And majority of the time it is done like this, with closed eyes. Okay, without actually a reason being a reason to open up the vessel, whether it's going to give a real productive life for the patient or not. Okay, many a time it becomes a reflex to do a procedure without actually going through the underlying cause. Okay, and I think Dr. Rajeena was saying that people might be referring to the dietitian, and there was a discussion before this meeting about patients being referred to a dietitian. That basically means that teamwork will be like this. If you yourself do not know what you're going to prescribe to the patient, the teamwork is going to be like this only. Okay, so I thought I was just focusing on the tip of the iceberg. That is, I was focusing only patients with cardiovascular disease, and I failed to see all these things beneath the iceberg. So I didn't focus on subclinical atherosclerosis. I didn't focus on the physiological changes, and Dr. Rajeena kept pointing towards the behavioral changes, which are the ones which lead to physiological changes, which leads to subclinical changes, subclinical atherosclerosis, and then comes the cardiovascular disease. So we all see the disease, nothing beneath the disease process. Okay, and then we thought we should start focusing on all the 6 pillars. These 6 pillars are, for a physician, they all whenever something comes up new, we want to have some mnemonic. Okay, here the mnemonic is 2ESR. 2E stands for eating and exercise. 2S is for stress and sleep. 2R are for the risky substances like smoking, alcohol, and relationships. Okay. Okay. Now, all along, Dr. Rajeena was telling things have changed over the years, few decades and centuries. So, does that mean atherosclerosis is a modern disease? It's up to you to answer. The question is reflected on your screen. Pardon? No, it's reflected on your screen. If you could answer that, it will be reflected on the screen. Is there a problem in your net? So I don't see any response here. I saw one response in the previous question. Just to make it interesting. Is it opening in the system? I mean, your mobile? Okay. But I'm sorry, it's seen here. Okay, fine. So 67%, that's around 2/3, have said it's not a modern disease. Yeah, it is not a modern disease. It was known long time back. We'll connect it to the next slide. What is the best screening test for the primary prevention of cardiovascular disease? When a patient walks into a room and says, I want to know whether I have a heart disease or not, what is the best way to screen? Angiogram. So here it says primary prevention. So when you want to prevent, when the patient doesn't have a symptom, okay, so in that case we should never go for a invasive stuff, isn't it? So you cannot be doing angio for lakhs and lakhs of people. They have not come to you with a disease. They just want to know whether they have a disease in the process. Okay, waist, LDL cholesterol, waist circumference, LDL cholesterol, okay, lipid profile, fine. Physical examination, good. Yeah, I thought one particular answer will come. No, I was expecting somebody will tell at least treadmill. Yeah, calcium deposit is something. Okay. Okay. Now let's connect these two things. Okay. So here comes the first story. So this is the Egyptian mummies being subjected to CT scan, CT coronary calcium. Okay. So this is how the atherosclerosis progresses. Okay. The first thing is an intimal damage, and under the intima the fibrofatty layer gets deposited, and then calcium gets deposited. Subsequently there is a luminal narrowing, okay, and in the last stage the plaque gives up and then it becomes a MI. Okay, so if your ECG has to show something, and even should have happened already, okay, it doesn't pick up the problem at the earliest. Similarly, the echo also doesn't pick up. For treadmill to show up an ischemia, the patient should be having a significant amount of narrowing, and there is a good amount of false positivity and false negativity with the treadmill. So CT coronary calcium can be picks up the atherosclerosis much before it manifests on the treadmill. Okay, because even before the luminal narrowing happens, the calcium can get deposited. Does that mean calcium score is an advanced indicator of an early disease? No, it also means it's an advanced disease only. Right now, this is the only screening method without basically putting the patient through a major problem, major side effect. Okay. Now, why these two questions came up? Okay, that's because in these Egyptian mummies, those times they didn't have they were not smoking. We have no data about whether they had sugar or they had blood pressure. All these modern transport systems were not there, so they had to be on their feet, and majority of them were actually consuming lot of plant-based food only. Okay, so why did they have disease then? Any guesses? Pardon? No, one thing, let me make it clear, the calcium deposition happens in the coronary arteries only when you have atherosclerosis. It is not related to aging at all. Unlike the ones which you get in the radial artery and all other arteries, whenever you have a calcium in the coronary arteries detected by the CT scan, it is always indicative of atherosclerosis. It's nothing else. So the treatment of calcium deposition is basically treatment of your atherosclerosis and nothing else. Okay. So why do you think these people had calcium despite being active and having more plant-based diet? Okay, we don't have any idea about the genetics, but what we know is that this mummification process was done only for the elite people. Okay, the kings, their families, and the people who supported them, especially the priests. Okay, how did the priests support them? The priests will take them to the god, and the Egyptians believed that they have a second life, and that will be facilitated by offering food to the god. And what sort of food? This was the food which they offered. Okay, they had animal-based food as an offering to the priest. Okay, here you can see there is a leg of an animal is being offered, and the bird has been killed. And when you go through the literature, they said what they were taking is actually a lot of beef, wild fowl, cakes, wines, beer, and a lot of goose. And goose is something which has a huge amount of saturated fat. So this is the main reason. And see what the mummies had in the pyramids. So the pyramids had mummies of the person who died as well as the ones which were sacrificed. So they had a lot of animal mummies also along with that. Okay, because they believe on the way to reaching God, they all needed food. That was the belief. Okay, and incidentally, I saw one more thing. These priests had stolen some of this food without even offering to the god. So this situation was there even earlier also. Okay. Okay, so that establishes one point. So the food made a big difference in the elite people those days. So why do you think diet is so important? Can you have some scribbling on the screen? We all have so much of advances in the treatment. We have stenting, we have surgery, we have a lot of drugs like statins, aspirin, clopidogrel, whatnot. Okay, so we have so much of medications, and why should we be actually sitting on the diet? Something very specific. Okay, maybe the context was not well understood, doesn't matter. So I gave an example saying that a lot of things have come up as new form of treatment. Okay, like for example statins, I said aspirin, etc., etc. Have they all abolished IHD, ischemic heart disease? No. So when a representative comes and tells us the information which he has been fed on, he comes and tells you statins, or you for that sake, this drug brings down the mortality by 30%. Our mind doesn't think that there is another 70% left out. Yes or no? Yes. Okay. So this is the most important thing. This shows the residual risk with the modern treatment. Okay. So the residual risk is between 50 to 70% with whatever treatment we do. When you do a CABG, you do a PCI, you do a stenting, what we do is make the patient less symptomatic. We are not blocking the atherogenesis process. Okay. So intra-heart study, this is the major study which was done in 52 countries, showed few details that cholesterol and smoking will account for 2/3 of the major issues. And in the prevention, if you are going to have more fruits and vegetables, the incidence of heart disease comes down by 1/3. And if you connect it along with walking and abstinence from smoking, 80% of the diseases can be prevented. Okay, this is far better number than what our pharma industries have projected to us. Okay. And we also know, we all keep saying that alcohol is protective, but this study has clearly shown that it is not protective amongst South Asians. And we know this very well. Risk factors and heart. When somebody asks us what are the risk factors, we tend to say that it is hypertension, diabetes, obesity, smoking, dyslipidemia, all those things. So these are the ones which lead on to a bunch of things called coronary artery disease, cerebrovascular disease, chronic kidney disease, peripheral vascular disease, and heart failure. So when you look at CVD patients, only 50% of the time you will have one of these risk factors, one of these 4 giant risk factors. Rest of them don't have any risk factor. Okay? But when you include lifestyle risk factors, that is dietary factors, physical activity, smoking, stress, all the 6 pillars, 2 ESR I said, you cover 90%. Okay? So this is a study from Lancet. This is the Global Burden Initiative done in India. What according to you is the major risk factor for heart disease? This was a publication in 2016. I don't think it has changed. The present ICMR guideline quotes this one only. Okay? So what is the leading risk factor for heart disease? Anyone? We saw so many things. Obviously the talk is on diet, so it has to be a dietary risk factor. Okay? So we have one question. So how many physicians are here in this group? How many of you see diabetic patients? I'm sure every other specialty will be saying diabetic patients. So which guidelines do you follow? Is there a specific guideline which you follow? Or at least what are the guidelines which are spoken about in general in meetings? Generally people talk about American guidelines. If the doctor has come from UK, then they talk about European guidelines, isn't it? These are the 2 major guidelines which people talk about. Okay, dietary guidelines are very difficult to form, and that's why a lot of contradictory things have come up. Methodology is very, very difficult to ask what you ate this morning. And to collect those data, it's going to be extremely difficult. And you know it's very, very difficult to conduct a randomized control trial, especially if you want to have a double-blind control trial, which are the gold standards. So it's going to be very difficult, and that's the main reason why there are so many controversies. So what do you think the guidelines are saying? If you have read, you can say what do the guidelines say? Any guideline, whatever you want to say, it's any national guideline, whichever you want to write. What do the national guidelines say? Dietary guidelines tell us as to what we should follow to bring down the heart disease. But no, I'm talking only about the dietary guidelines. So I'm not.
Reduce the fat intake.
Reduce the fat intake. Okay, can we have it on screen so that we'll know what? Just it'll take fraction of seconds.
Mediterranean diet.
Mediterranean diet. Maybe you can have some broad outlines because not everybody will be familiar with DASH diet, MIND diet, or it's just broad outline. Let's have it in our own terms. Low carbohydrate, high protein. Okay, here there is fiber-rich, plant-based diet. Okay, well, let's not wait for the one. Next question is very, very direct. Do guidelines prescribe whole food plant-based diet? Let's have the answer here. I can hear yes, but I can't see yes here. It takes time, isn't it? Because I am not typing, only you know what's happening. When I see here, nothing is happening. That's why I kept on telling you people, please type. Okay, 1/3 of the people have said yes. So I presume that rest of the people have said no. Let us see the guidelines, what they have said. Okay. So one on the top is going to be your American guideline. The one on the bottom is the European guideline. So what's the selling point? In American guidelines, they say reduce the energy intake, okay, and expenditure to achieve and maintain a healthy body weight. What does the European guidelines say? Adopt a more plant and less animal-based food protein. Okay. I can challenge here that many of the cardiologists will not be knowing. Many of the diabetologists, with the ADA releases the guideline every year. Okay? Every year when it comes, people see what is the new drug which has come. Nobody has time to see what is recommended as a physical activity, what is recommended as a dietary recommendation. Okay? Look at this. 2019 European Society of Cardiology has clearly said it is going to be a plant-based diet. What about fruits and vegetables? Eat plenty. That's the American guideline. What does the European guideline say? More than 200 grams of fruits and vegetables per day. Each. That is important. More than 2 to 3 servings each, which basically means it should come to 4 to 6 servings. So if you want to ask your patient one question which is going to determine his fate, it is that it is going to be on vegetables and fruits. Are you taking 4 to 6? So the movement should be towards taking more vegetables and fruits. Okay, whole grains, well, I think half of it is gone already. So plant-based diet and whole grains, it has come up. Okay, it is whole food plant-based diet. Americans have not spelled it out as whole food plant-based diet, but the Europeans have said it as whole food, though both of them meant the same thing. Okay. Regarding fat, they have categorically said anything from animal fat, avoid. Any saturated fat, avoid. Okay, proteins, look at that. Predominantly plant-based. The American guideline here puts it as predominantly plant-based. The European guidelines for the entire stuff, they have said it is the food itself is plant-based. Okay. Okay, regarding processed foods, they are very clear. Ultra processed foods definitely should go off, and minimally processed foods should be minimal. Salt intake, both the guidelines are very clear, no excess salt. Alcohol, if you are not drinking alcohol, do not start it just because the guidelines say. That also they are saying. They are not, okay, they are very, very inferior. Okay. But if you choose to drink alcohol, limit the intake. Okay? It is given there in the European guidelines. Minimum of 100 grams per week, not per day. Okay? Okay. So, stick on to all these things. That's the final stuff. Okay? Sir was saying Mediterranean diet. Okay, fine. Now, the next question is like this. How many of you see Tamil movies? Anyone? Is this very rare? Okay. You see. Okay. Well, all these guidelines have the habit of telling that you follow a scoring system based on few parameters, like say height, weight, your age, sex, your lipid profile, sugar, sometimes renal parameters, sometimes autoimmune disease. Various guidelines have come up. I'm not touching upon that because none of them are applicable to our population. Okay? Many of these things we have not come out with our own guidelines, our own scoring system. So I'm refraining from that, but I'm using the scoring system which has been used by the Europeans here. Okay. So if you belong to one high risk category, so here is the one. Okay. If your risk is more than 10%, that means you are under a high risk. If your risk is less than 10%, you are under moderate or low risk. Let us not bother about what is low, moderate and all, because it differs between guidelines to guidelines. Okay. So the green one here indicates high risk, what is to be followed by the high risk individual. The red one indicates what can be followed by the low and moderate risk individual. Okay. Now, as far as the high risk is concerned, say I have put, this is little paradoxical, isn't it? For the high risk I have put up green, and for the low to moderate risk I have used red. Does it make sense? Okay, we'll discuss that at the end. Okay, so plant-based diet, plant foods. You take fresh fruits. That basically means you should be avoiding juice. More raw and cooked vegetables or cooked vegetables and pulses. Okay, here you can use little bit of potato. You can use little bit of jam. You can also use little bit of canned fruits. Okay. Unrefined carbohydrates. So use whole, unpolished rice or the brown rice. Here you can use little bit of white rice and little bit of pasta. Okay, almost same fiber. You can, when you use wheat bread here, you can use white bread here. Okay. So as less of animal-based milk as possible. Here you can use some ice cream once in a while, some biscuits, pastry once in a while. So similarly, if you want to use any fat substances, it could be for a high-risk patient. It's going to be only few types of oils, whereas here you can use some mayonnaise, cheese, etc. Salt, prefer to use as little salt as possible. Substitute them with herbs and pepper. Okay. So now can you tell me as to why I have used green for high risk and red for low risk?
Neglected part is very high.
If you are going to use all those green ones, you are not going to be high risk at all. If you are going to use all that red ones prescribed for the so-called low risk and moderate risk, you are going to be at high risk. Does it make sense? Okay.
So what about coconut oil?
Yeah, coconut oil also, I don't know whether I read it out. Coconut oil is very clearly not recommended. Dr. Rajeena very clearly said that also. Okay, if you're going to use fish, then you have to use only those oily fish. If you're on a low risk, well, the rest of the things have been included. Red meat, as little as possible. See the quantity which they have said, 2 to 3 times per week, not per day, again. Okay? Okay, and egg they have accepted up to 7 per week, that means 1 per day. Processed meats, yes, totally go off if you are at high risk. So soya protein substitutes can be used. Again, water is the best beverage. Don't go for a sugar sweetened beverages. Alcohol, okay, minimal or very low. Now, I was asking about whether people see Tamil movies. Have you heard? I don't know whether anybody can read Tamil here. Do you know this actor who is there? That I think you can't say no. It's Kamala Hassan. Okay? Here Kamala Hassan is selling chicken. Okay, and the other actor is a comedian. Other actor is Senthil. Okay, Senthil is given a specific instruction that he is supposed to get one chicken which weighs 2 kgs. Okay, one chicken which weighs 2 kgs. So he goes to the stall, asks for a 2 kg chicken, which has to come from one chicken. Okay, I hope I'm not confusing here. But Kamal doesn't have that type of a chicken. So he gives 2 chickens, one 1.5 kg, one half a kg. So Senthil is taken aback. He said, no, I cannot go home like this. I want only one chicken which has 2 kgs. So Kamal's reply is this. This 1.5 kg is present day chicken and the other half a kg is when he was young. Can you connect these two things with the previous slides? Nobody gets into high risk category one fine day. Everybody goes through a low risk to moderate risk to high risk. So where is the question of including a little bit of everything in a low and moderate risk? So basically everybody has to be on a whole food plant-based diet with minimal processed food and very little animal food. Okay, so when the initial definition of whole food plant-based diet is that nil animal protein. Finally it changed. I believe, I couldn't find a reason for that. I believe that is to make this food sustainable. Similarly, the guidelines possibly have incorporated all these things under pressure and still continue to say that you can eat a little bit because they are still under pressure. Okay? Okay, well, I changed all these slides and I'll show this one. This is the only slide possibly I want you to take home. Okay? All that in green are supposed to be taken in excess. All that in yellow are to be reduced. All that in red are to be avoided. Let's focus only on the things which are to be taken in excess. Clearly, vegetables, fresh fruits, whole grains, 2 servings per day. Okay? The grains are whole grains and not otherwise. When you come to a simple carbohydrate, reduce it as much as possible. Go for 1 serving of nuts and seeds and as little as, not exactly dairy, but they say yogurt, and 4 servings per week. So again it comes down. Okay, this is all that you need to know. Well, this again I'll skip, or maybe I can show this. There are plenty of guidelines. I talked only about 2 guidelines. There are plenty of guidelines, and see that all that in green, majority of the guidelines say you take more vegetables, it will reduce the heart disease. Majority of the guidelines say that you take more fruits, it will reduce the heart disease. Okay? 3% of them were very specific. I think this guidelines came from Japan. They said don't take more of heavily sweety fruits. Okay? And similarly, see, many of the guidelines are definitely against even alcohol. Okay, none of us are familiar with that. Okay, so here is a summary of this various guidelines. United Kingdom, Australia, Belgium, Malaysia, Malta. They say plant-based diet is a complete diet. Okay, and see the other one, Qatar. Qatar also says it's a complete diet, which is the most unexpected. Qatar guidelines in 2015, that's nearly a decade ago, they said it is for a complete diet and to avoid processed foods. Norway clearly says it's useful for all age groups. The Nordic Council says it prevents heart disease and chronic inflammatory disease. Even the Chinese guidelines on the Hong Kong guidelines say that it reduces inflammation and prevents from infectious diseases. Finland says if you are going to take more plant-based diet, you're going to move more and you're going to smoke less. Canada says to avoid milk proteins, and they have actually taken off milk from the protein section of Canadian guidelines. Okay, and they say go for a plant-based protein. Belgium says calcium can be obtained without dairy clearly, and they say water is a good source. And they also says that go for fortified plant-based milk. Netherlands and Nordic Council go for they promote these diets for environmental reasons. So what is this plant-based diet? So whole food plant-based diet has to be like this. Half of it should be coming from vegetables and fruits, 1/4 from grains and 1/4 from proteins, predominantly plant-based proteins. Okay, I'll just go off for one slide. Shruti, you may have to help me. I have to open the previous PowerPoint. Question asking people to use 5 letters, 5 alphabets. Can you note it down? Because it came in the slides, it's not here, I'm sorry. E, R, H, E, your turn, E, R, H, A and T. So make use of these 5 letters and coin 2 words without repetition. 2 letters, 2 words. Pardon? Where is this PowerPoint? How do you go to that? Shruti? Sorry. Letter word called plant. Okay, so if we want to protect the planet, we all know that we have to plant lots of trees, isn't it? But what is important is eating more plants will save the earth, because it's going to reduce the gas emission and use of the lands for the animals. Okay, so you are what you eat. And let's coming to this last question. What is that? Any guesses? I didn't see that. I remember one answer there. Some keratin, to do something keratin. Yeah, hyperkeratinosis. This man had malignancy and he was actually smoking through his stoma, the operated site. Okay? So it's imperative that we remove the cause, and the cause is basically the diet for majority of the diseases. Thank you. Thank you for the patience with me. I think once she finishes, we'll take up the question. That will be better. Dr. Vindhya.
For Dr. Vindhya Kurunji, MBBS MD Community Medicine. Dr. Vindhya is a dedicated physician specializing in community medicine. She earned her MBBS and MD in community medicine from KVJ Medical College and Hospital, affiliated with the Rajiv Gandhi University of Health Sciences, Bangalore. Dr. Vindhya has contributed to notable research, including studies on personal hygiene practices among food handlers, nutritional status among adolescent girls, and anemia prevalence in rural and urban areas. Her professional experience includes serving as an assistant professor in the Department of Community Medicine at KVG Medical College, a medical officer at ART Center, KIMS, Bangalore, and observing under the endocrinology department at Manipal Hospital, Hebbal. By this, I hand over the mic to Dr. Vindhya to continue her speech.
Good evening, everybody. After listening to Rajeena ma'am and Rajendiran, I'm new to plan and I'm learning from them. So I'll just go through my slides today. Yeah, today's agenda. So what is diabetes mellitus and its burden? What is a plant-based diet? Role of plant-based diet in prevention and treatment of type 2 diabetes, and guide to how to switch to a plant-based diet. So everybody knows the definition of diabetes mellitus. WHO has given a definition to diabetes as a metabolic disorder of multiple etiology characterized by chronic hypoglycemia with disturbance of fat, carbohydrate and protein metabolism as a result from modulations in insulin action, insulin secretion or both. So diabetes epidemiology. So there are 537 million adults living with diabetes according to the latest guidelines. 3 in 4 adults with diabetes live in low and middle income countries. 6.7 million deaths due to diabetes are recorded in the year 2021, and 240 million people living with undiagnosed diabetes. So that is a scary part. And diabetes in India. India is the home of the world's second highest number of diabetic patients within the age group of 20 to 79 years. And India has 74.9 million diabetics in the year 2021, projected to increase to 124.9 million by 2045. So this is a picture of pictorial projection of how the prevalence of diabetes in each state of India. So let's come to what's a plant-based diet. Plant-based diet. The term plant-based diet encompasses a wide spectrum of dietary patterns which emphasize plant products such as fruits and vegetables, whole grains, legumes, nuts and seeds, and plant-based alternatives, and limit or exclude animal-derived products. However, there is huge variability in plant-based definitions between studies, and as the popularity of plant-based diets grow, plant-based terminology also has evolved, like plant-centered, plant-predominant, plant-rich, plant-focused, plant-mode, etc. So the classification of the plant-based diet goes like this: vegan, raw vegan, vegetarian, lacto-vegetarian, ovo-vegetarian. Yeah, it goes on. So the vegan diet, it abstains from all types of animal products, and the raw vegan, it includes an average of 75 to 85% of raw food. And vegetarian diet are characterized by not having any animal products, including meat, poultry, fish, and seafood. Lacto-vegetarian means is inclusion of dairy products. Ovo-vegetarian refers to the inclusion of eggs in the diet. Then there's something called as pescatarian diet, which includes the consumption of fish. Then flexitarian is a semi-vegetarian diet in which the animal products are limited to a few portions per week. So again there's something in the prevention of the non-communicable disease, especially the diabetes. We have the lifestyle measures, interventions. And lifestyle medicine, it has 6 pillars. It's already discussed by Dr. Rajendiran sir. So the whole food plant-based eating pattern is one of the 6 pillars of the lifestyle interventions: physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. So what is the significance of plant-based diet in prevention and treatment of diabetes? It first of all reduces the risk of type 2 diabetes mellitus. The effects are like it improves the blood glucose concentration, body weight, plasma lipid concentration, blood pressure, and reduces the risk of cardiovascular and microvascular complications. So cell is a fundamental unit of our body. So each cell, it needs energy to work, right? So how do we provide energy to the cell? By glucose. Okay, so when the cell is not able to metabolize the glucose normally, it will lead to diabetes. Is diabetes only about sugar or the glucose? No. Having diabetes with high cholesterol or high BP means you are at even higher risk of heart disease and stroke. So we have to also think about salt and fat intake in the diet. This is about the normal glucose homeostasis. The insulin plays its role. So pathophysiology of diabetes due to chronic overnutrition and prolonged hyperglycemic state. It promotes lipid accumulation in the skeletal muscle and liver, called as intracellular lipid, which ultimately leads to systemic insulin resistance. So the systemic insulin resistance finally leads to the occurrence of type 2 diabetes. And this the role of phytonutrients. So this is where the plant-based nutritions come into role. So the phytonutrients of plant-based diet, they are also called as phytochemicals or the antioxidants, are bioactive compounds generated from secondary plant metabolism. Phytonutrients have protective effects on insulin sensitivity, reduce systemic inflammation and oxidation stress, enhancing the gut microbiota and promoting weight loss. So these are all the pathways, how the mechanism of action of antioxidants from phytochemicals on diabetes mellitus, the excess production of radioactive free radicals through different processes induces oxidative stress. It's all prevented by the phytonutrients. And this anti-inflammatory action of phytochemicals derived from natural products on diabetes. Phytochemicals like flavonoids, stilbenes, alkaloids inhibit the inflammatory cytokines produced by macrophage and dendritic cells through different mechanisms, including modulation of mast cells, etc. So the plant-based diet, they reduce the risk of diabetes, hypertension, dyslipidemia, etc. So the fibers. So what are the fibers? They are the undigestible part in the food what we consume, and it helps in the maintenance of the gradual sugar increase in the blood. So the fiber intake should be abundant in a diet, and it can be gotten through the plant-based diet. The fibers plays crucial role in maintaining digestive health, regulates bowel movements, promotes satiety, and fosters a diverse and thriving gut microbiome. So there's several studies showing that the high carbohydrate and high fiber diets are accompanied by dramatic reduction in insulin requirements and serum lipids in selected patients with diabetes. These regressions in diabetes have been sustained over 3 years in patients who have successfully followed these modified diets. These observations suggest that the fat-restricted diets providing generous quantities of complex carbohydrate and dietary fiber may have therapeutic usefulness for most adults with diabetes. High carbohydrate, high fiber diets may slow the progression of arteriosclerotic vascular disease in individuals with diabetes. And we get wide range of micronutrients through the plant-based diet. Iron, vitamin C, calcium. And the protein from the plant-based diet we can get it from the soybeans, tuna, they have like all the. And then several studies also shows that with the lesser consumption of animal products, there's a lesser risk of the occurrence of the type 2 diabetes. So there are several programs like diabetes prevention program, which has also compared with a metformin drug and lifestyle modification to see which one works better in the prevention of from the occurrence of diabetes from the pre-diabetic stage. And lifestyle modification actually has a better effect than the metformin. But only the drawback was in lifestyle modification was the adherence with the study groups. So after 3 years in the diabetes prevention program, after 3 years, it showed that the participants in the DPP lifestyle change program lowered their chance of developing type 2 diabetes by 58% compared with the participant who took placebo. The DPP lifestyle change program was effective for all participating racial and ethnic groups and both men and women. The program worked particularly well for participants ages 60 and older, lowering their chances of developing type 2 diabetes by 71%. About 5% of participants in the DPP lifestyle change program developed diabetes each year during the study, compared with 11% of the participants who took a placebo. Participants who took metformin lowered their chance of developing type 2 diabetes by 31% compared with participants who took a placebo. Metformin was effective for all participants, participating racial and ethnic groups and both men and women. Metformin was most effective in women with a history of gestational diabetes, in people between the age of 25 and 44, and in people with obesity who had a body mass index of 35 or higher. So, treating of type 2 diabetes through plant-based, how does it affect? The plant-based diet, it has lower fat, higher fiber, high water content. This leads to overall lower calorie density, helping maintain a healthy weight and fat mass, improving glucose control and insulin resistance. Plant-based diets have shown to be part of successful treatment of type 2 diabetes by reducing medication, improved HbA1c and lipids. Primary approach of management of type 2 diabetes is to achieve and maintain weight loss. Evidence has shown a multifactorial intervention in the form of caloric restriction, exercise behavior change has optimal effects in improving glycemic control and weight. Dietary restriction therapies for management and cessation of type 2 diabetes have mainly focused on weight loss through the implementation of either low-calorie diets defined as 1,200 to 1,500 kilocalories per day, or very low-calorie diets ranging from 450 to 800 kilocalories per day. Current literature supports very low calorie density diets, illustrating that such diets are superior in inducing or promoting rapid weight reductions, improving insulin secretion and lowering HbA1c to levels seen in pre-diabetics or normal hypoglycemia. Emerging, let me skip this. Let me skip all this. Rajeena has already discussed about all these things. So, are all plant-based diet healthy? Let's go to the plant-based diet. Everything is need not be healthy. Okay, let's go to the definition. A healthful plant-based diet that emphasizes consumption of only plant-based foods such as whole grains, fruits, vegetables, nuts, legumes, and healthy oils, while reducing intake of less healthy plant food as well as animal foods. An unhealthful plant-based diet that emphasizes consumption of less healthy plant foods such as fruit juices, refined grains, pasta, white rice, processed breads and cereals, potatoes in the form of French fries and potato chips, and sugar-sweetened beverages, while reducing the intake of healthy plant foods as well as animal foods. So this is a picture showing the healthy and unhealthy plant-based diets. So the unhealthy plant-based diet, they contain the ultra-processed foods are often high in fat, sugar, salt. According to the ICMR, they call it HFSS foods. Regular consumption of HFSS are known to increase the risk of non-communicable diseases like diabetes, hypertension, and cardiovascular diseases. These are the ultra-processed foods that we can see in everyday life in India. And next, so animal-based or derived foods or processed foods, how they promote in the development of diabetes mellitus or mellitus. These are the metabolites that can lead to the development of diabetes mellitus, nitrates and nitrates, AGEs, high levels of branched-chain amino acids in the blood like leucine, isoleucine, and valine, high consumption of saturated fat, heme from red meat, choline and carnitine, low fiber, and which leads to unhealthy gut. So low carb animal-based diet and low fat plant-based diet. Here I wanted to I projected this picture because just to say that if you like the low carb animal based diet like the keto diet, it may be helpful in treating the type 2 diabetes, but it's only symptomatic. It's like giving paracetamol for occurrence of infection for the if somebody has a fever and not antibiotic. But plant-based, the proper whole food plant-based diet will treat the root cause of the diabetes, and the keto diet will be usually it will be only treating the symptom and not the cause of the disease. This is how a healthy eating plate looks like. The whole grain, Rajeena and Rajendiran sir has already shown you all this. This is a Canadian nutrition guideline, how the plate looks like. 50% of the plate is filled with vegetables and fruits, 1/4 of the plate with the whole grains, and 1/4 of the plate with the proteins. This is the ICMR 2024 guidelines, according to the 2024 guidelines. So how do I start? If anybody wants to change to a whole food plant-based diet, how can you start with the changes? How can you start with making changes? Set a smart goal. The goal should be very specific, so like and measurable, achievable, realistic, and time-based. You should start with make one changes in a day. Like how will you snack in a day? like between the meals, the 11 o'clock snack or the 4 o'clock snack, instead of having the packet snacks, you just change it to having some fruits and nuts. Like you practice it for a week, and and you see how the changes happen. How you can make the changes slowly. You can make changes for the breakfast and lunch and dinner, and that's how you make the smart bowl changes. See, instead of fruit juices, you can shift to the whole fruit, where you get even fibers to your body. And instead of having the ultra processed chips, you can have the carrots and cucumber. So this is an example of a meal plate. An ideal plant-based meal plate, how it looks like this. This is another picture of another ideal balanced plant-based meal plate looks like. So what is the difference between these two plates in this screen? Yeah, is it a complete plate in the left side, or which is a complete plate in right or left?
Right.
Yeah, right side is a complete plate. Again, which is a complete plate here? Right. Yes. What is the issue in the left side plate?
Deep fried.
Yeah, and paneer. I can see paneer, but there's paneer, right? Again, what about this plate?
More carbohydrates.
Yeah, white rice and more of carb, less of fruits and vegetables. Okay, so this is an ideal the taste meal plan. This is how it looks like for breakfast, lunch, dinner. And there are these are the studies that prove even that cardiovascular complications can be managed. Diabetic neuropathy is and CKD, retinopathy, everything can be managed. Even the conditions in type 1 diabetes mellitus also can be managed. Thank you.
We have heard today in the platform of IMA topic we have heard today. So for making this platform very interesting, I thank Dr. Rajeena Shahin, lifestyle physician and then medical director, All India. Thank you, madam, for excellent talk. And Dr. G. Rajendiran, so cardiologist and then medical advisor, All India. Thank you, sir. And Dr. Vindhya Kurunji, ambassador, All India. So thank you, madam. So I think we are joining for the dinner now, and then any questions are there, I think, from the audience side? We can take up some questions.
So what is this pan-India?
So please.
Physician Association of Nutrition.
So do you want to answer this?
Yeah, better from your side.
Pan-India.
Suti? Physicians Association for Nutrition. That is basically a global association.
Pardon?
Okay.
Yeah, yes, better.
Transformation needed to mitigate the three largest global health crises: chronic health, climate change and pandemic risk. So I'll take this deeper dive into this, that what is the global movement for healthy and sustainable nutrition. One is nutrition and individual health, second is nutrition and planetary health, and third is nutrition and pandemic risk. After COVID-19, the world has been completely changed. So our mission is to mitigate completely diet-related, nutrition-related diseases, especially in the non-communicable diseases. So PAN, Physician Association for Nutrition, is a global NGO having its presence in 7 countries of world. And non-communicable diseases are the fundamental crisis of modern healthcare. Heart diseases, obesity, type 2 diabetes, and other chronic diseases are responsible for most premature deaths globally. And the most important risk factor for the development of these diseases is poor nutrition. And this is what we talked about in all our 3 speakers. And I hope, not about our health, for planet as well. So our mission is to have healthy diet for people and healthy diet for planet as well, so that we can cure from the scratch to the end. And this is our core team. Dr. Alan Conver is a strategic advisor of PAN, and he is currently working from USA. Dr. Nicholas, and he's a chairperson of PAN International. And Dr. Rajeena, medical director. We have, I am also a program manager. We have other 2 members, Bhavani and Rinki. And Dr. Rinki Singh is our executive director, and Bhavani is the coordinator. She is also coordinating this event virtually. And what PAN India focuses on initial years. So we work in a 3 direction. One is educate, empower, and engage. So we have other programs as well. You guys can engage in the webinar series which we have. We have journal club. We have discussion forum. So you all are in the group already. So I request you to all please stay connected with us. We will make this group more engaging. Dr. Vindhya will be posting some opportunities for all the doctors. Not for the doctors, if you know someone who is doing MBBS or is a part of medical fraternity, can join us in a journal club. We have scientific community who is having completely discussion over why we are not able to handle diabetes, why India is capital of diabetes in the world. So this is what we are doing, and we have very good speakers in our webinar. These are the oldest speakers, but after that we have 10 and 12 speakers, and they all are from the global perspective. Then we have journal club. We have completed 17 journal clubs in our where we have nutritionists, where we have doctors, where we have light healthcare science background students as well. Apart from that, we have discussion forum where all the doctors are having discussion on the very good topics like ultra processed food, protein remission, etc. And then we have Convo Connect where all you guys are already there. This is our journal club team. Dr. Sindhura is heading this. We have Dr. Preetam Vedas, we have Ditesh Fasale, and we are having all these team not from the specific region. We have completed and covered all India science professional in that. So it's better we have like all the perspective regarding this. This is our discussion forum team, and this is the meet which I would like to highlight here. Here you will see like all doctors from various parts of India came together to bring this mission forward, to strengthen the mission, and they all are working in the plant-based community who are promoting plant-based diet to mitigate all the non-communicable disease and premature deaths globally. And all of them have having at least 20 plus years of experience. And this is not just we are promoting plant-based diet, we are promoting evidence-based nutrition. And that is why all the doctors are here, they are having their books. And we will talk, we will keep on posting about their views on that. We have done, this is our 17th CME, which we are holding, 16th CME, yes.
and 17 is coming. Now we are having AIMS Madurai and AIMS Mangalagiri as well. So by this month, we in just 1.5 years, we have completed 18 CME and 6 and I think 6 and 7 AIMS we have already covered, which is the one of the best institution of India. And this is the PAN work, and we had this seminar in BMCRI Bangalore as well. So apart from that, not only that, like we are having like completely focus on doctors, and we are nurturing prodigies. You can see the kids who are sitting here. So these kids are already following whole food plant-based diet, and it is not just we are preaching only. Dr. Rajeena's daughter, and here you can see she is our ambassador who is following plant-based diet, and she is in 9th grade right now. And yeah, she just passed 9th grade. And this is the chef training program, which was again headed by Dr. Rajendiran, and these are the chef of the one of the very good hotel of India, and we train them about how they can include plant-based diet for the travelers who are coming from across India and like thinking to have healthy food in hotel, but they think that we cannot have. But still, Dr. Rajendiran's effort, we train them on that, and it is going across India too. And I request you all to be engaged in our group so that we can involve you in another project, we can involve you in our all endeavors, and Dr. Vindhya will keep on sending messages and the related stuff to that. Thank you so much.
Animal health is very much related with the plant health and also animal health, like and ecology. So that is how I think everything, every issue discussed here was in line with One Health. So I thank the team for making this successful, and I thank our fellow Dr. Samdhyanaya, all IMA members making this event nice. Okay, thank you one and all. Let us join for the dinner. So let us have some small.
What we promised.
Yes.
Sorry for that.
So yes, it was nice. Thank you so much, ma'am. Thank you. Yeah. Thank you, ma'am. Yeah, take one picture, ma'am. So much is taking.